Would you two please introduce yourselves?
Well, hi, Melissa. So good to be back. I'm Dr. Laura, part of Prescribing Life, part of the Prescribing Life team, and I'm here with Miss Dana. So, do you want to tell a little bit about yourself?
My name is Dana Reed. I live in Waco, Texas, and I learned about you in 2019 or 20. I can't remember. But I was starting to wake up to everything that was going on in the world. I used to be brainwashed like most citizens are out there. And I started waking up. You helped in that process. And then during the perfect time of my life when I was starting to experience a lot of pain in my back that was preventing me from doing daily activities, you were sharing a story with your mother about your mother and how you visited Prescribing Life and how it helped her. And at that same time, I was petrified of Western medicine because everything I was learning. And I thought, I'm going to take a chance. I have nothing to lose. And this is what brought me here today.
Yes, that's so wonderful. Yes, if you don't mind me telling, so Dana is like my soul sister now. I'm so glad to meet you, Dana. And of course, Dr. Laura. Everybody knows how much I adore Dr. Laura because she saved my mom's life. And she was just such an answer to prayer, such a godsend, because my mom, as many of you know, was on 3 opioids a day because the doctors were trying to kill her, and saying that, and there was no hope. There was no hope. They gave her no hope. And so then we went to Dr. Laura, and now literally in the past few months, my mom has gone on 2 cruises. She went to Tahoe, she went to Guatemala, and she just got back from, I think she's going home from Orlando tomorrow. I mean, just she goes and goes and goes. And so this is such a wonderful thing. And look at you. You look like $1 million. So yeah, you've been on the Freedom Force Battalion, and then you had scoliosis or have scoliosis.
I think I was born with it. I can't believe they didn't catch it when I was little, but it was never dealt with, and it's just progressed, and I have just dealt with it.
And then you had surgeries.
Not non-related to my back, just other surgeries and things that would come up. And I found out, okay, well, let me go back a little bit. So I used to keep my grandkids a whole lot, and that requires lots of lifting. And I would find at the end of the day, it would take, I would hurt, and it would take me 2 or 3 days to be able to walk again. And after doing this, I couldn't even go to the kitchen. My husband would have to serve me from the couch. So it was very bad. It just felt like when I would put weight on my feet, I would want to collapse. And it would send the nerve right down through my legs. And when I heard about your mom, I'm like, this is worth a shot. And David came in, my husband came in from work, and I said, you're fixing to think that I'm crazy. But I heard something today on this podcast, and we're going to do it. And I don't want no sass. We're just going to do this. And he's like, okay, let's do it.
And so car. What's the holdup? Why are you not in the car?
I got on the phone immediately, made an appointment, and we did, we were doing FaceTime.
Yeah, we did telemedicine.
Yes, telemedicine. And I bought 10 sessions right then. I was like, when do we start? Let's do this. And so I started sessions immediately within 7 treatments. Within 7 treatments, I felt like I was good enough. And so I didn't even come back for the last 3 treatments.
Okay.
Which I should have.
Right.
Shame on me.
Right.
But that just tells you how aggressive the stuff works, because I went from not being able to function around my house to fully 100%.
And no negative side effects.
No negative side effects.
And that was done in less than 2 months, probably. Everything we did. So yeah,
that's amazing.
It starts working fast.
Yes, that's wonderful. And so what you were saying before is that, Dr. Laura, that the surgeries and the cutting into the nerve tissue affected her scoliosis, and that was exacerbated by maybe the stress on the holding the children or whatever, right?
Right. So that's what we usually don't think about, how everything that happens into our body, and that includes any kind of trauma, fracture, surgery, is not just affecting a muscle or a bone, a tendon, right? Or even our skin, but that's all cutting through our nervous system as well. Our nerves are responsible to send signals, and that includes, of course, a signal of pain. And when something's not right, it's gonna start perpetuating that signal. What happens is when those nerves got cut, they try to heal, like our body's gonna always try to do. So what they do is, let's think about a nerve as basically a wire, and there is running electricity through it, because that's actually what's happening. So when it's cut, it tries to heal and to get fixed, but the electricity can't run in the same way in many cases. So symptoms will start showing up. So like, for example, Dana, she's saying, well, I had scoliosis since I was little, but she didn't have any symptoms when she was little, and that's why they didn't call anything. She didn't have any symptoms when she was a teenager because she was fine. But then over time, over surgeries and other different traumas, that started damaging the nervous system. So the symptoms start appearing. So the first time we treated her, she was, everything went really well, because we were dealing with those old issues, of old traumas that were going on. And it worked tremendously fast, like it usually does. And she had such good results that she didn't have to.
I was in
she had to
shock.
go back.
I was in shock.
Yeah.
Yes.
And in total disbelief, because it's contrary to what Western medicine's answers to everything.
Right, exactly. And you think, you know, they give you no hope. They're like, okay, the only hope we have is for you to be on, you know, debilitating pain medicine.
Yes.
You know, but we have none of that with Dr. Laura. Nothing
So,
like that.
Exactly. And with Dana, the thing is that we have like 2 cases in one person, because that was the first time she came, and that's when she was in that case, that debilitating pain, but not knowing what to do.
Yes.
Right. And then she had this horrible accident.
Right.
Right.
And so here's my second story.
Oh my goodness.
So
You're too much.
this one was created through some fun.
Yeah,
So that's
so
always a
fun,
good
fun,
thing. Good,
fun.
you know, I took my grandkids skating, and I used to be a DJ when I was young. So I was going to go show my skills off, right? And so we're skating away, and I'm teaching my daughter-in-law, my grandkids, how to skate backwards. And all of a sudden, boom, I fall hard. And I remember my body went cold, passed out. My son came to my aid. Long story short, I told him no ambulance. I couldn't move on the floor. I was laying on the ice skating, or not ice skating, but on the skate rink floor. And took me probably half hour to get out of the building. Finally, he loaded me up, and I decided I'm going to go home and self-heal, because no doctor at the hospital is going to be touching me.
Yeah.
And so, plus it gave me a time.
I hear you, girl. I hear you. I'm very skeptical, but go ahead.
Well, I just wanted to kind of assess myself. So I went home. Within 2 days, I realized I had to go. I thought I had to. I didn't have to. I went to a Western medicine doctor going, I need x-rays, something, to see if I broke something, because I'm not moving.
Yeah.
And so they chose to do a CT scan. Well, they did. The doctor comes back in the room and says, you're fine. You'll be fine. This was on a Friday. He said, you'll be fine by Monday, probably up and walking. Here's some medicine. It'll get you back on your feet. Yeah, well, Monday came. I'm still not back on my feet. A month later, I'm still not doing fine. 2 months later, and a part of this is on my bad for letting it go that long, but this is how petrified I am.
Right. And it's not an unfounded fear, because there's all the things that we have heard, and you just want to know that you're putting your body in the hands of someone that you trust, that they know what they're doing. First of all, we've had too many people who get misdiagnosed, and that they're going to do things that are holistic for your whole body. So, you know, and also you have that hope that, okay, maybe I'll feel better in a week, you know, and so I understand that too. So continue.
Well, so 2 months in, I'm still not getting any better. And now at this point, I'm getting depressed. I feel like my life is over. And I'm talking to the world right now, because I know I'm speaking to somebody.
My mom's there. All she's doing is living on a couch.
Yes, that's what I was doing.
Trip was to go to the bathroom. That was all she ever do. Yeah.
Yes.
It really can make you feel like, hopeless pretty quick.
Makes you feel hopeless. It tests your spirituality. It tests obviously your physical well-being, your emotional well-being. It changes who you are at the core. And I finally just admitted to my husband and faked it to the rest of the world, because I have to be the strong person. I don't like to be vulnerable, so I don't show tears to people, and I don't like to share if I'm hurting because I don't want to sound like a whiny baby. But my husband would get it all. He would hear all of it. And I just felt like I finally decided to reach out to Laura when I decided I'm broken. I had to do something. But before
Well,
I went,
I don't even think you thought about that she could fix this at first.
I was confused. I couldn't even make
You're
a
not
decision.
thinking. That's the problem. When you're in pain, you can't think clear.
You
No.
cannot be clear. So before I went to her, though, I wanted to address every potential possibility so I could pray about it and then let God lead me. So the doctor that saw me the next time in February, he decided to do an MRI because even though the CT scan showed nothing. So he does an MRI. Well, that's when we found out that is the L5, the L1 was fractured, the L5, my vertebrae were crushed. I have a bulging disc and sitting on nerves. Wow, right? So I went from a CT scan that showed nothing to this MRI. And now I'm like, now this makes sense. Now what am I going to do about it? So this doctor said, here, we got two options. I can either send you to a specialist over here that will give you steroids and he'll burn your nerves and what else? Horrible things. And I opted out of that one. And he said, or you can go see a neurosurgeon.
And this is really interesting too, because I understand where you were coming from, seeing it as a structural problem, right? Like you were thinking, I have a fracture. This has to be fixed. Someone putting it back together, right? And probably that was what was trying to lead you into the direction of surgery, or what else? What's the other possibility there? Or I need to look, like you said, I need to look what's going on there.
Right.
But at the end of the day, and you see, even with images, they were showing different things. Exactly. So I completely understand. But and I remember it was actually your husband who contacted me first as well, to just figure out, like, is this something that will be able to help Dana?
Right.
Like, can we do something about it?
We don't want to just drive up and down the road and just waste our time.
And I completely understood. And I always tell them and tell everybody, like, thank you for your trust, because most of our patients come from out of the city, and from somebody in pain, it's just so hard just to get in the car and do that. That's I know, or take a flight coming here. So I understood what you were coming from, but I knew, especially knowing, like, you responded really well, like most of our patients. So I knew there were many chances that we could work on your case. So that's what I told David.
Well, and it's also, let's try it before we cut any more.
Exactly. And that was our decision to say, okay, well, you guys can do, of course, whatever you want, but before you go through that, let's try something that, first of all, is not going to cause any side effects. It's going to give us results. If it's going to help, it's going to show us very soon if it's going to help. And you're going to know if it's going to give you relief. So why wouldn't you try it? At the beginning of the treatment, we were doing it almost 4 times a week. And now we are at once a week. So it has changed tremendously. And how Dana looks and what she's able to do has improved.
That's wonderful. That's wonderful. Well, and also it makes, for those of you who've not heard us talk about Prescribing Life before, this is about neural therapy, where the nerves are treated subcutaneously, very, very non-invasive treatments. And bottom line, the pain is clearly, we know this from 3rd grade science, the pain is traveling through the nerves, right? It sends the signals through the nerves, so that it's not a pain blocker like you would think of, or burning, or doing any of that stuff, or cutting it, or whatever. It is about calming the nerves down, so they're not like a pinball machine sending all these signals, and reducing the inflammation, because when they're like so irritated and angry, then they're going to send all these pain signals. So am I explaining it right?
You are, Melissa. And what I loved, instead of me at the beginning of the video, is just me explaining something that might not make sense, or it will make sense. It's just a story, your story, right? Your journey, and showing that something that works. The results, I think, speak louder than anything else. And now I can tell you, so yes, neurotherapy, what we're doing is something extremely safe. It's just the application of local anesthesia. Everything we do is minimally invasive. It doesn't require any downtime or anything like that. So and the results are very quickly, but most importantly, we're not just stopping the pain, but helping your body to heal. And proof is Dana is not not healing just her nerves, but actually her structure, her structural spine. So that's wonderful.
May I add something? So because I've been coming here since February, I've spent a lot of time in the waiting room, right? Meeting people. And I've got the gift of gab. So I'm always asking for one, what are you here for? How long have you been here? What caused it? And let me tell you what I found. Every single person that I have talked to found their way here because of a surgery, because of a neurosurgeon or some trauma that happened outside in Western medicine. And they're here to fix problems that occurred, and it might not showed up immediately.
Right.
In time, it causes more pain down the road. And they're all here to fix a problem that was caused from surgery.
Yeah.
Which
right. And it takes you down that path to where now you've got to be on this debilitating pain medicine.
Yes.
You have no quality of life.
And people here are no longer on medicine anymore.
Right?
They're not on medicine. Yes.
It's amazing. It's amazing. So, but we're not allowed to say Laura's healing anybody. Never, Lord of mercy, we don't want to say that, right?
Right.
Yeah, it's really wonderful. And don't think that when we talk about local anesthesia, it's not about numbing you. You don't feel numb. Now, I will tell you when you get a treatment, because Laura's been helping me through this after the poisoning because my nerves were damaged from the poison. Okay, so and they're being revitalized, and look at me breathing like crazy, But sometimes when you do get a treatment, you kind of feel a little drunk. Right. For a minute, a little like, woo, that was good, but other than that, you don't have any effects,
Exactly. And that as a side effect, it means that we are adjusting the nervous system, resetting it. So usually the nervous system is in a fight and flight response, which means we're working with the sympathetic nervous system. So usually we're all anxious and stressed, right? So one of the things that neurotherapy does is take you to the parasympathetic nervous system, which is the one that is relaxed and allows your body to channel the energy that you're spending on stress, on cortisol, and other things that are actually damaging or not helping you heal, channeling that energy into healing. So that's what helps, is your body healing itself, really. We're just leading you into that direction.
Yes.
And I know that's the medical part of it, but let me tell you, she would never brag on herself. So that's what I'm here to do.
Okay. Yeah.
So when I first started treatments, of course, you're looking at a person that's not hurting very much anymore, right? But when I first started, I was a little crybaby when I would come in here, and I don't let people see me cry, but Laura got to see me cry. Oh. And anyway, she saved my life.
Amen. I know.
She helped me with medicine, but more than anything, spiritually fed me, and she emotionally fed me. I feel like she gave me my life back.
Yes.
And it's been an honor, really, Dana. Thank you so much for being here, for your trust, and seeing you blossoming and being the person who you really are, because that's what Prescribing Life is really about, to give you your life back. It's been amazing for me.
I love you.
I do too. I love her more.
We love her, and I love you for telling me about her.
It's such an honor. I'm so thankful to be a part of this. This is so fun for me to be able to use Freedom Force Battalion channel where we talk about all this craziness, for this healing. If you guys, anybody out there, if you're hurting, we're not, I hope it doesn't sound like we're doing a sales pitch, because this is not what it's about.
No,
I'm not making any money off of this. I'm just trying to help people save your life. If you are in pain, this is the answer. It is the answer. Please
do not hesitate.
I don't know. I guess I shouldn't give medical advice, but I know I'll probably be sued. I don't care. I just want everybody.
It's okay,
I just hate this stuff, this medicine stuff. So I want everyone to be well. And this is where we're headed, you guys. You know that from the book, End Times in 1,000 Years of Peace, we're going to have 1,000 years of health, and everyone's going to learn how to do neurotherapy. And this is where we're headed, because they've never had this type of treatment. They've just kind of left the nerves to just fend for themselves and not really try to help, and of course forget the word healing. They don't even think about doing that. And so now we're going to have that, you guys. The Bible, as you know, it says in Isaiah 65 that we will live as long as trees and have time to enjoy our hard-won gains. Isn't that the truth? So I wanted Dana to come on here. Thank you, Dana, for coming in and joining with me.
Thank you for inviting me. I appreciate
Laura.
it. I jumped at the chance. Thank you.
Yes, I'm so glad to know you. I really, really am. And just another beautiful testimony of just the beautiful days that are headed are coming our way, you guys. Just hang on tight. And if you're in pain, just go to prescribinglife.com and you don't have to be in pain. Okay, guys? I love you. Let's before we go. Thank you so much, Lord. Thank you so much.